Welcome to the Medicine Box Health Matters, where we delve into the health topics that truly matter to all of us. I'm your host, Ekta Batra. Today, we shine a spotlight on a vital aspect of our well-being, ear, nose and throat, or ENT health. ENT issues are far more common than you think, yet they often go undiagnosed and untreated. In India, some of the most common ENT problems are persistent ear infections to sinusitis and acid reflux. But there's more at stake. ENT conditions can deeply impact our quality of life. Take hearing loss. For example, it affects 5% of the global population, cutting across all age groups, from children born with it to musicians exposed to loud noises, and even those who suffer multiple or severe viral infections. Astonishingly, over 6 crore Indians suffer from significant auditory impairment. India is also home to one of the highest number of children with hearing impairment in the world. Vertigo, another common inner ear issue, affects 15% of the global population, with a staggering 18 crore Indians grappling with balance and dizziness disorders. Meanwhile, sleep apnea has emerged as a public health concern, affecting an estimated 10 crore people in the country. And let's not forget, India has some of the world's most polluted cities, amplifying respiratory problems. Today, we are privileged to welcome a titan in the field of ENT health, the esteemed Dr. Kirtane, a Padma Shri awardee. Dr. Kirtane has performed over 2,000 cochlear implant surgeries, bestowing the gift of hearing upon countless children and adults. Join us for this special conversation on ENT health. Welcome to the show.
One problem which I have noticed, which I would like to mention here, is people coming with sudden deafness. And I remember as residents, we used to see it maybe once in 6 months. Today, I see 2 to 3 patients a week. If you have a chest problem, you can loosen up the secretions, so you can take steam and then you can cough out your secretions out a little better. But I don't think it has any role in preventing. If you are the one who tries to sort of boost up your music and you're hearing it all the time, I told you 80 decibels and above for a prolonged period is going to cause damage. Earbuds in the ear. That's a no-no.
Dr. Kirtane, thank you very much for joining in.
My pleasure.
Well, let's start by you giving us an overview on the most common ENT issues that you see in your practice and you have seen over all these years.
I would then divide this into children and adults because the problems are a little different when they present. Children most often come to us with runny nose, tonsils, adenoids. A lot of parents say that their children keep their mouth open and are snoring at night, restless sleep. This leads to problems in their ears and they get what is called a fluid collection in the ear. So they have deafness problems, sometimes it starts flowing and a ear discharge starts. So that affects their day-to-day life. They can't go to school so easily or they don't follow what's happening in class. So this is some of the commonest problems that we see in children. Of course, there are some children with respiratory problems as well because they're also exposed to the pollution that you just mentioned. In adults, I think the common problems that I encounter are imbalance and vertigo, hearing loss. We have a lot of senior citizens now coming in, good health, mentally, physically very fit, even in their 80s, but they have hearing loss. We have a lot of professionals who come with problems of voice because of overuse and again pollution, virus infections. And vertigo is also one of the problems. A lot of times patients keep on coming because it's difficult to deal with this. So these are some of the common issues that we face in practice.
But have you seen it increase in the past couple of years, say in the past decade?
Respiratory problems, definitely. I think the pollution levels are high. Also, we have so much of work going on, construction, the metro work, so a lot of dust in the air. So a lot of people with respiratory problems, definitely on the rise. One problem which I have noticed, which I would like to mention here, is people coming with sudden deafness. And I remember as residents, we used to see it maybe once in 6 months. Today, I see 2 to 3 patients a week. Now, whether this is virus related, whether there are new viruses around which are causing this, we don't know, but there certainly is a rise in this. A lot of people coming with sinus problems, breathing problems, also perhaps related to the pollution.
But,
And
but is the sudden deafness related to the
we
incremental
don't know.
rise?
We feel that when there is no other apparent cause, we feel it is viral. We treat it with steroids, etc., hoping to minimize the inflammation. And maybe the number of viruses which are now around are far more than what it was, say, 50 years back when I was in training. So the definite incidence of sudden hearing loss, the patient goes to sleep normal, wakes up with 1 ear completely gone, is happening rather often.
Okay, well, I'm just going to get to air pollution in a bit, but before that, you mentioned adenoids. That is something which has come up in terms of pediatric care multiple times. What does one do when they have, toddlers or children with inflamed adenoids? Is surgery the right option for all of them? If so, when?
If the adenoids are large enough to produce significant obstruction, which means the child cannot breathe at night, is sort of struggling, snoring, the parents tell you that the child keeps on tossing and turning in sleep, tries to adopt a particular posture to try and breathe. Yes, definitely we would treat it conservatively initially, but if the problem persists, we would advise surgery, even in the age group of 2 to 3 years, 4 years, because it is affecting their general growth as well. There is a definite relationship between poor oxygenation at night and that snoring that happens, because they're also not getting enough oxygen during the night rest period. And it has definite implications as far as growth is concerned. The child's attitude, irritability, capacity to concentrate, all these get affected, and physical growth. Also, it leads to ear problems. So, if a child really has large adenoids which is impacting quality of life, we would definitely recommend surgery.
Okay. The other point that, statistics show that globally we've seen the rise of recurrent respiratory infections post-COVID. So how does one treat those recurrent respiratory infections? Is it always treated with just, say, looking at the symptoms, waiting for them to die down? Or do you eventually need to start antibiotics? And if so, how often?
Antibiotics really should be used only when there is definite evidence of a bacterial infection. The patient has fever, is unwell, is producing sputum which is purulent. Not every person who comes with a cough needs antibiotics. And post-COVID, yes, because of certain changes that have occurred in the lungs, they may have persistent cough. Doesn't have to be treated with antibiotics. There are specific indications to say, okay, in this particular case, he's running fever, the counts are high, and then you would go for a treatment of the bacterial infection with antibiotics.
And for children, the same applies?
Same applies, yeah. There is a tendency every time the child gets a sore throat, give antibiotics. No, that's not really on. You monitor the temperature. Everybody has innate, resistance power, can overcome infections. So you have to give that a chance as well. You might give them symptomatic treatment, but antibiotics should be reserved only when clearly indicated. Otherwise, overuse of antibiotics, you would land up with people getting resistant infections and your antibiotics would stop working. Yeah.
Okay, well, talking about air pollution, Dr. Kirtane, what are the long-term implications of air pollution, considering that India has some of the most polluted cities in the world?
See, the way pollution would affect you, it would produce an inflammation in the lungs because of the pollutants. So when there is inflammation, the normal processes that lead to transport of mucus, which is formed in all the respiratory tract, that gets affected. And whenever that happens, that becomes a ready-made medium for the bacterial infection to set in. So whether it's allergy, which produces inflammation, or pollution that produces the inflammation initially, makes it easier for bacterial infection to set in.
Any preventive methods that you would recommend when it comes to protecting yourself from air pollution?
That's a big problem. It can't be just protecting yourself. You will have to have regulations brought in from the government side to see how to minimize the pollution from factories or whatever activities are going on. You'll have to have technological advances which will say how people can reduce their pollution, And then of course each individual will have to be aware that these are problems and pitch in from his side whatever he can do. But as an individual, to protect yourself, avoid going into places which are polluted, or if you have to go there, wear a mask, be properly protected.
Would you recommend wearing a mask in any case?
In today's scenario, a lot of people are still wearing masks and nobody gives them a second look. So I think if you are in an area where some digging is going on, construction work is going on, I think it's absolutely sensible to wear a mask and protect yourself.
Okay, and what about using public transport or on an everyday basis?
Yeah, because if you're in a crowded bus and people around you, I think you don't know whether the next guy has got an infection or not. So in a crowded public place, wearing a mask would make a lot of sense, yes.
Okay. Well, you know, one of the statistics for India indicates that sinusitis is in fact more widespread than asthma, diabetes and heart disease in the country. What leads to sinusitis and what is the best way to probably resolve it?
You know, every time you get a cold, technically you will have sinusitis because the nose and the sinus lining is continuous. We talk about sinusitis as a disease when it starts giving symptoms like nasal discharge, postnasal discharge, feeling of fullness in the face or even headaches. That's when it becomes significant, and you have it in two parts. You have acute sinusitis, which can occur, you know, over a short period of time, and if it's with purulent discharge, fever, etc., pain, headaches, you would want to give antibiotics. Target the antibiotics according to what you feel is necessary, along with decongestion so that the sinuses are allowed to drain. And then you have chronic sinusitis, where people have an ongoing problem. Usually they have some basis. So a person with strong allergies will more likely have chronic sinusitis. Exposed to pollution, continuously working in a polluted atmosphere, more chances of chronic sinusitis. And what happens in this is that all our sinuses are producing mucus like your nose, and it drains into the nose with tiny holes, ostia, what we call them, channels. And when you have allergy or a virus infection or pollution, there is swelling which blocks these channels. So the sinus cannot drain, and that leads to sinus changes, chronic sinusitis. And if it doesn't settle with medication, then you have to go and operate on them. And now with the endoscope, the surgeries are far more delicate. All that you have to do is to go and widen the opening of the sinus, allow it to drain, and you can take care of sinusitis.
Okay. Allergic rhinitis, you know, when people are sneezing, they have some kind of allergy. How does one treat allergic rhinitis or any kind of allergies, and especially if you can't identify the allergen?
You have to give them symptomatic relief by giving anti-allergic medications, which may be by way of tablets. You can have nasal sprays. But we make it very clear to the patient that there is no anti-allergic tablet, at least in allopathy, which cures your allergy. It just controls it. You know, it's like treating a patient with diabetes or with blood pressure. You don't say you cure his diabetes, you control it. Blood pressure, you keep on taking medication, you control. And a lot of our patients say, well, I took the medication, I was okay, I stopped the medication, it comes back. So the only way to get a cure would be to identify. Today you have people who do skin tests, and I think they have about a 70% success in identifying your allergen. If it's something that you can avoid, something in the food or some cosmetic that you're using, stop using it.
Okay.
But if it's dust, if it's pollen, if it's grass, if it's fungus which is in the air and you can't avoid it, then you have to ask the allergy or allergologist to prepare a vaccine.
Okay.
You're sensitive to that thing, you need to desensitize yourself by gradually increasing the dose of the vaccine. It's a therapy that goes on. Formerly we used to give it injectables. Now you get something that you put under the tongue. So it's called sublingual immunotherapy. And if you have identified it correctly, then you can get cured of your problem.
Okay. So in all of these respiratory issues, a lot of people have asked whether one should, you know, do steam inhalation, and how useful is it? How much should one do it? And is it also preventive?
I don't think steam inhalation is preventive. It makes you feel good. You know, any part which is hurting, you apply a little heat, feels good. If you have a chest problem, you can loosen up the secretion, so you can take steam and then you can cough out your secretions out a little better. But I don't think it has any role in preventing, except that if you are in a very cold surrounding, and there are people who are sensitive to cold. I get patients who say, I have 1 glass of cold water and my throat really goes. So maybe the temperature of the steam might give you a little assistance over there. But by itself, I don't think steam can really prevent.
And fix?
Not really fix. It's more of a symptomatic relief that you would get with that.
Okay. All right. Well, Dr. Kirtane, we need to take a short break, but we have a lot more questions. Stay tuned.